Good evening, everyone. As you are coming in, please complete the survey in the chat. As you are coming in, please complete the survey in the chat. Again, welcome everyone. As you are entering, please complete the brief survey. When it asks you for your group, it is the Black Greek Letter Consortium. Again, thank you, ladies and gentlemen, for joining us tonight. If you check the chat for those just coming in, please complete the brief pre-survey. Your host groups are the Black Greek Letter Consortium and the National Black Nurses Association. Again, for those just joining us, please complete the pre-survey. The link is in the chat. Your host groups are the Black Greek Letter Consortium and the National Black Nurses Association. All right, good evening, everyone. We are going to go ahead and get started with our webinar series tonight. Once again, thank you all for joining us. I am Crystal R. Brown. I am the National Director for all of us with Zeta Phi Beta Sorority Incorporated. And tonight we are discussing Black maternal health. This is a very important conversation pertaining to our community. And again, we want to thank you all for joining us for this tonight. All of Us Research Program is a historic and innovative program designed to gather 1 million participants to create a database of clinical research. The goal is precision medicine. The program strives for a database encompassing volunteers of all backgrounds with a focus on minority and underrepresented populations. This includes communities who have historically insufficient representation in medical research, including African Americans, Hispanics, Asians, Native Americans, and those with disabilities. So as part of this research program, we're going to talk about different things that affect us in the community, especially for people of color. And one thing that does not get discussed is maternal health, especially within the Black community. So we have with us tonight two experts who will be providing us a wealth of information. And I'm going to turn it over to my co-director, Dr. Siobhan Chambers-Williams.
Good evening, everyone. So I have the privilege of introducing two powerhouses in the medical field. First up, I would like to introduce Dr. Joanne Patterson, who is a doctorally educated, nationally board certified psychiatric mental health nurse practitioner by the American Nurses Credentialing Center. With over 20 years of experience as a nurse, she has provided care to thousands of expectant women and children. As a nurse entrepreneur and psychiatric nurse practitioner, she established a private practice in Maryland. And recently, yes, recently, even in a pandemic, expanded to Nevada and the District of Columbia, where she specializes in reproductive and pediatric psychiatry. She also is a wife, a mother, assistant professor, and if that was not a long list, she serves as the international director of the Stork's Nest Prenatal Education and Birth Equity Program for Zeta Phi Beta Sorority Incorporated, where she mobilizes over 120,000 members to serve expectant mothers and babies in their communities. Next, we have Dr. Julius Johnson, who was born and raised in Brooklyn, New York. He wants you to know this, in the Brownsville and Crowns Heights neighborhoods. He received his Bachelor of Science with a major in nursing and his Master's of Science with a major in family nurse practitioner from Binghamton University. He also received his Doctor of Nursing practice from the University of Miami. He currently specializes in home-based primary care and transitional care. He has spent the past 10 years serving underserved communities and reducing hospital rates for at-risk populations. He is a founding member of the Greater New York City Black Nurses Association and currently serves as the president. If he's not busy enough, he is also the founding president of the Omega Nu chapter of Sigma Theta Tau International Honor Society at Long Island University, Brooklyn. He is an assistant professor and director of the Family Nurse Practitioner at Long Island University, Brooklyn. In 2018, he was recognized as one of the National Black Nurses Association's 40 Under 40 Rising Stars. So as you can tell from the bios of both Dr. Patterson and Dr. Johnson, tonight's discussion will be one that is rich with a lot of great information, but we also encourage you at any time throughout tonight's conversation to place questions that you may have in the Q&A. And if you cannot find the Q&A, then feel free to use the chat because we want your questions to be answered. So to prepare for tonight, we have 6 pre-populated questions that will be posed to our panelists, and then we'll turn it over to your questions. So we're going to go ahead and get started. All right. So my first question is for Dr. Johnson. What can providers do to make patients feel more comfortable during pregnancy to help increase Black women attending prenatal visits more frequently?
Uh, Thank you, Dr. Sharifine. First, I would like to say it's a pleasure to be here. Uh, as a Black man, as the president of the Greater New York City Black Nursing Association chapter. So thank you for having me. And I think that the answer to this question is a lot. Providers can do a lot to make Black women feel more accommodating and feel more welcome, and which will lead to them attending more visits. We could start by listening more, understanding that some of their problems may be very unique. Also understanding, we can also do a lot more research to understand that they have reasons why they're not coming. There's a level of mistrust. And then we can start also by saying, what are the levels of mistrust and what are the steps I'm going to intentionally take to prevent or to enable my patient to come back and see me. We understand that a lot of gynecology things that are done now is based on treatments that happen to slaves or happen to Black women without their consent. So understand that that's been passed down from generation to generation, and then going the extra mile to make our Black women feel more comfortable.
All right, our next question is for Dr. Patterson. What does birth spacing mean and why is it important?
Sure. Well, also, I want to say thank you for, the invitation to, talk with I guess, the country, if however many is on, just thank you for being here. But when we talk about birth spacing, it is literally exactly what it says. It is spacing your births. And when we talk about birth spacing, it's really so that it is helping a woman's body to recover from the previous pregnancy. And that helps to ward off, complications that may arise from, having babies back to back. So what we like to see with patients as it relates to birth spacing is 18 to 24 months before the next pregnancy. And then even with, but you can still try to get pregnant anywhere up to 5 years. So that's where we talk about the spacing. Then if you're in advanced maternal age, which nobody likes to say because that's 35 and beyond, we usually ask for 12 months of spacing, simply because the body is just a little bit different. So we ask for that to be done. And then we also talk about preconception. So birth spacing, that all falls under preconception. And preconception health is basically what it says. So it's training your body really before trying to conceive. And that includes, making sure that you sort of plan this with your providers and start getting your body ready would be taking a prenatal vitamin, making sure your folic acid is on board. And that helps with the formation of the baby, making sure that the fetus has a good chance of, healthy development. So really and truly, it's to ward off the complications that may arise from the body going through that. And I don't want to call it trauma because it's not, but that pregnancy is a lot of work. Your body goes through so many changes. The blood volume increases. Your organs, they move. I don't think people realize that when the baby is growing, your lungs are shifting, your diet, everything is being pushed up and squashed. So you've got to give your body a little bit of a break to kind of recover from that.
So, as a follow-up, Dr. Patterson, you started to allude to this, but for those mothers or mothers to be, is there anything they should change about their lifestyle immediately
Sure.
in the prenatal stage?
Okay. So the one thing that I want to get in everyone's spirit, if they're pregnant or planning on getting pregnant, is to make sure that you commit to the prenatal care. and to seek early prenatal care. That is so important. So, there's the prenatal visit where you sort of don't feel well, and all of a sudden you go to the doctor to see what's going on, and it's surprise, you're pregnant. So there's that visit, but then there are others to follow, and you have to make sure that you're committing to the process. And I know that Dr. Johnson just spoke about, not really wanting to trust that process because of all the things that we have been through as Black women as it relates to obstetrics. But for us to be able to, and this is, I guess, on our part, meaning providers, we have to commit to the notion of providing a culturally appropriate care. So it's a symbiotic or a two-way street as it relates to, just getting ready. And then the other thing would be nutrition, decreasing your salt intake, increasing vegetables, fruits, water intake, so 6 to 8 glasses of water a day. So you're committing to healthier behaviors, right? And so with the water, you're actually giving your body that chance to, replenish and develop properly. Not only that, but if you're really interested in that pregnancy glow, then the 6 to 8 glasses of water helps to keep, your skin looking great. And, people are saying, oh, girl, you're glowing, all those things help. So it's nutrition. It is also taking your prenatal vitamin, as I already spoke about. And then it's also increasing your activity with your permission of your OBGYN, midwife, or family nurse practitioner, or women's health nurse practitioner. So increasing your activity is another thing. So a walk, or, whatever pregnancy yoga classes that's available, all those things, or even, sometimes it's moving, moving a little shuffle to a song, anything that you can do to just keep that blood volume going. Because the other thing that happens in pregnancy is that your blood volume expands. So as this baby is growing, your body is changing and trying to adjust to all the needs of that growing fetus. And then, of course, if you are a smoker, or you partake in a little bit of a adult beverage here and there, then those are the things that you would want to sort of scale back on and actually stop doing. And I know that sometimes it's hard for women to do that, because smoking is one of those things that either you do because it just helps to calm your nerves or what have you, but there are other alternatives that could take the place of that. And, with that being said, if it's difficult for you to do on your own, then, reaching out to your provider to see if there are any programs that you can, sign on for, so that it can help you with changing those behaviors. Because what happens with smoking and what happens with drinking alcohol is that, of course, the fetus is at risk. And then, of course, with the salt intake, that's another thing. So we're talking about high blood pressure, which is so dangerous, so dangerous in pregnancy, and even more so for women of color. So I know that we'll be talking about that a little bit more, so I won't, talk too much about that. But those are the things that you definitely need to do in terms of, shifting and committing to the process of being pregnant.
All right, so Dr. Johnson, what are some interventions to utilize in preventing death from eclampsia, postpartum hemorrhaging, and other issues Black moms face?
So it's interesting because this piggybacks right off of what Dr. Patterson was just talking about with high blood pressure. So with eclampsia, that really starts with preeclampsia, which is the elevation of blood pressure. So understanding that if your blood pressure starts to rise, you're starting to become more at risk. Also understanding the other signs that come along with it, like the swelling in your hands and feet, understanding the urine and your protein. But I know a lot of times if you're not going to prenatal visits, you're not going to get to that part of understanding that there's protein in your urine. So the first thing is we need to get you to a specialist, and you need to understand that. If your provider that you have is not a specialist, meaning a specialist that deals with high-risk pregnancies, because at that point you're high risk. If they're not one, you need to tell them to refer you to one, not to handle the problem on their own. because it's not just where your provider is, meaning where you go see them in their office. You want to be at an institution, meaning a hospital you're going to deliver at, that speaks that same language of high risk pregnancy, right? Everybody knows, everybody is on board. And it can be the difference between whether the baby lives or the baby dies, and whether the mom lives and the mom dies. So getting to your specialist, understanding the signs and symptoms, and then also listening to what you are told. Like if you are at high risk and they tell you go home, take it easy, you're on bed rest, that really means that you're on bed rest, right? It doesn't mean that you can still take care of the other children. You have to get help because you're putting yourself at risk. The development of preeclampsia is eclampsia, right? High blood pressure, swelling of the hands and feet. Then that develops into stroke, seizures, and all sorts of other things. When you're talking about postpartum hemorrhaging, you really have to understand that you're at risk of bleeding out sometimes. I have, and even some of my nurses that I teach who gave birth talk about postpartum hemorrhaging and bleeding out and what that feeling is like. So understanding that that's an issue, understanding that if you have any kind of complications, you want to make sure you bring that up. If you have a partner that's with you, whether that's your husband slash wife, or if you have a doula with you, making sure that you're communicating your concerns and that your concerns are being heard and that you're being tended to by the providers there.
All right. Wow. That was a lot. So shifting gears, the baby has been born. And so touching a little bit about postpartum. So this question is for you, Dr. Patterson. What is the difference between baby blues and postpartum depression and/or anxiety? You're muted, Dr. Patterson.
So, yes, this is a big one because, in our communities, mental health and just that whole notion of, being in tune with your mental wellness is one of those things that we kind of forget about during this whole thing. And I always like to talk about this, one, because it's the area that I specialize in, and two, I think it's just, important that we do. But the difference between, and then, we call this, most of us call it the postpartum, right? But there's a marked difference between baby blues and postpartum depression. So with the baby blues, it is literally something where your mood swings quickly from happy to sad. One minute you're, really happy about being a new mom, and the next minute you're crying because you think you're not up to the task, or you don't feel like eating or taking care of yourself because you're exhausted. You also feel irritable and overwhelmed and anxious. And so there's just a lot of crying. It happens, shortly after the pregnancy, but that subsides. You kind of get into your rhythm, you transition to being a new mom, and things get better. Where it doesn't sound like baby blues is when, or when it starts to look a little bit more like postpartum depression, is when the feelings of hopelessness, sadness, worthlessness, crying more often. We're past the week or two. It's now, month 3, and you're still feeling the same way. You don't feel like you're doing a good job. Attachment to the baby is a big one. So, there's this beautiful bundle, and you are a little bit detached from the whole experience. There's no smiling with the baby, no cooing, no, snuggling. And that is pretty detrimental to the development of the infant. The infant is learning all of those cues from you as a mom. And when you don't feel like those things are happening, when you know that you'd rather just, put the baby down in the crib and just not even deal with, that whole thing of feeding and changing and wanting to, do the whole motherhood thing, then that's when you definitely need to reach out. Most mothers will reach out to their OBGYN, their midwife, or women's health nurse practitioner. But then there are specialists. There are specialists in the mental health arena that specialize in this area where you will get, a specialized form of care. So I always wanted to say that because I think the public really doesn't know that there are, we're unicorns, don't get me wrong, because it is a really fine, minute specialty, but we are here. And so I would definitely start reaching out, or your primary care provider could then make the referral to a specialist to help you along with that. The other thing is that you're not eating, you're not sleeping, you're not taking care of yourself. So there's no motivation. You don't want to take showers. You don't feel like, interacting with family. They want to come over and see the baby, and you're like, I don't think so. Those are the kinds of things that you need to watch out for. And that postpartum depression will linger if it's not treated. So month 3, you're still feeling that way. Month 6, it's still happening. Irritability, fights with your partner. I don't think, we need to pay attention to those things. So if you know that that's out of your character, then that is something that you need to kind of, note that you're just not yourself. And postpartum depression can last up to a year. So you would have not missed your entire first year with your baby, but it would be a different experience if you don't, get it treated. And that could be therapy, it could be medication, it could be both. So, I just want moms out there, or women who are thinking about becoming pregnant, or even if there are aunties or grandmothers on in the gap for their nieces or daughters or granddaughters, to know that it is okay. It is really okay to, seek help for that, because if left untreated, things can go south really quick. So those are the differences between the two. And then there's anxiety. So the anxiety part is, just being anxious about the whole thing. And, not being able to sleep at night because you want to make sure that the little sweet one is breathing. So you're going in and you're checking to make sure things are okay. You don't want people, around, just being anxious about the whole thing. Breastfeeding. So breastfeeding is not going well, or the baby is crying, and that just sends you on to level 10. That is, a few telltale signs of the anxiousness that comes with, being a new mom, or even a second mom, third or fourth, because you may not have those same signs and symptoms with the first pregnancy, but it may happen with the second one. So, there are so many resources that we can provide as it relates to, maternal mental health. And I believe that there is a bill, or I think a bill we're trying to pass that through, the Momnibus. That's important because it's covering a lot of these things, because, again, moms are kind of out there flapping in the wind when it comes to that support. And if I can just say one more thing before, I know it's probably the time frame, but the Stork's Nest program, that's a good avenue, and we'll talk about that later, but the Stork's Nest program will assist with those types of things. So having a pregnancy plan, a birth plan, and a postpartum plan, those are the types of things that will help you to sort of design the kind of care that you want, because then, there's a blueprint for your providers, your significant other to follow. If things start going, not as planned, there is a blueprint for someone to follow and say, okay, this is what she really wants to happen. I think that alleviates a lot of the anxiety and uncertainty as it relates to pregnancy as well. So there's a lot of things that we can offer from the Stork's Nest program in that respect, and we'll talk about that a little bit later.
Sorry, I was muted. Dr. Johnson, after pregnancy or postpartum, what are some issues that Black moms should bring up to their providers?
So part of it, Dr. Patterson talked about in dealing with their mental health. You always want to bring that up. That should be a question that they're asking you. Another part of that is talking about birthing space. Your provider should bring that up to you. One of the things that moms forget to bring up often is telling them about anything that happened during the actual pregnancy. there's a big focus on baby after um, is a big focus on baby after the baby is born, right? But a lot of it is mom, right? How are you doing physically? Did you have excess bleeding during the pregnancy? Did you have eclampsia during the pregnancy? Did you have gestational diabetes during the pregnancy? These are some of the things that your provider should know because, for example, if you have gestational diabetes, which is the fancy way of saying you didn't have diabetes before you got pregnant, when you became pregnant, you developed diabetes. And after you give birth, magically, you no longer have diabetes. What happens often is that after later on down the line in life, they end up developing diabetes, right? Same thing with hypertension if they have preeclampsia or eclampsia during pregnancy. So these are some of the things that you should bring up to your providers because they should start talking to you about diet, exercising, getting you going, making them just aware of it. And then also just how you're doing physically and emotionally, just not forgetting about yourself, not forgetting about your care.
If I can also add here too, I wanted to add uh, moms giving a health history because sometimes that's another one when you go into these doctor's appointments and there's about 15 minutes for you know uh, care to provide care to patients. I think it would be helpful. Again, I think I touched on this before. The pregnancy plan, postpartum plan, writing down your questions before you go in there, and probably even when you make your appointment, just letting the secretary know that you have questions that you would like to address with your provider, so that they know that you're coming in with questions and they should kind of make room. I'm not saying that they're going to spend an hour with you because of the way just healthcare is, but at least they are not taken aback by the fact that they're having to partition out time on the fly for you.
And also, just to add to that, I think this goes back to what Dr. Patterson was talking about in regards to supporting the Mommy Bus Act. Because through an act like that, we can push for, okay, all health insurances have to pay for a postpartum visit for the mom. Not only do you have to pay for it for the mom, there's also mandatory questioning that you have to actually go through. And you know what? As a provider for doing this, you'll get reimbursed a whole lot more money for it. I guarantee you, providers will be running the streets looking for their patients who had just given birth so they can see them, right? So it incentivizes the provider. It guarantees the mom is going to get excellent care. And some of those things, it may sound obnoxious or unrealistic, but those things happen all the time. The first visit that the baby has following birth, one, it's mandatory that you have to see a provider within 48 hours after giving birth, right? I'm talking about from after being discharged. And then the list of questions that goes on during that is extensive because it's mandated that they do it because they also get reimbursed for it as well.
So thank you both so much. So at this time, we do have our first question from our attendees. And so this question, a really good one. If you do plan on having kids after the age of 35, she didn't say 36 or 42, but after the age of 35, what steps should you take first?
So first step, understanding that it is normal to have children after the age of 35. That's the first thing you need to do. Normalize it. It is okay for a woman to say, I don't want to have kids right now. I don't want to have kids when I'm younger, or I want to have kids after I feel like I'm secure in my career. It is okay. Normalize it. Understanding that when people say you're more at risk for certain things, also understand the numbers, right? Because hearing the words "I'm more at risk for something" also gets convoluted with "I'm very at risk for something," and the two don't equals, right? It just means that there's a, let's say, a 10% chance of something else happening more, right? But also keeping in mind that 75 to 80% of the moms that have birth after 35 don't have any issues, they go full through. But it means that, so after 35, you're more likely to have, and by more likely meaning 5%, 5 to 10% chance higher than a woman that's younger, have premature birth, are to have gestational diabetes, to have high blood pressure during birth. Interesting one, you're also more likely to have twins, right? So I know some people, you may think I'm gonna get this last child. You might end up with last children, right? Which, is also a blessing. So these are some of the things that you should look at.
Yeah.
Why did you have to say that part? Okay, I'm sorry, Dr. Patterson.
Look, I want
Right,
twins.
we all kind
so
of perked up when we heard twins. Like, wait a minute. So I actually have a question off of that. Is there any particular reason why there's a more likely chance of twins? Because this is my first time hearing that information.
Well, there are hormonal changes that take place, as you get older. So, your ovaries could release more than one egg at the same time, or multiple eggs at the same time. And then, when we have to be really real here. So sometimes when you're having or trying to have kids over the age of 35, it might not work out as planned. And so then there's reproductive technology that we partake in. And that's another way that, you could end up having multiples because of the process that you go through, meaning through infertility clinics or that sort of thing. And so you'll see that then too.
Also, want to normalize the in vitro process that Dr. Patterson is talking about. A lot of times we think as Black people, that's not for us. Or look, all this technology that has been developed and proven to work throughout the years should also be utilized by Black people. So understanding that that is a normal option that a lot of people take if you're having trouble conceiving.
Very normal.
And I think that's part of the thing. We don't normalize a lot of things in our community, and we don't do the research. We don't ask the questions that need to be asked. So we kind of just go off of generational information. So things that have just been passed down in our families, which may or may not be true, may have been misconstrued, or may just be someone's own personal experience. Like that twins part, I've never heard of that, didn't even think about what could cause it. But with that, we have another question in the Q&A. It says, how can we ensure that people who are getting government insurance get the same type of care as persons with private insurance? Providers may not give the same quality of care based on reimbursement.
So that's a layered question, and it's a layered answer, meaning that we have to attack it from different sides. We have to put a certain standard of care when we're teaching our providers at educational institutions that it does not matter the dollar amount that you are getting. You are there to treat people. And one of the reasons why I love nursing is that I always say other professions are trained in something specifically, like pharmacology is trained in pharmaceuticals, medical doctors is trained in like medicine and diagnoses, nursing is trained in people. So everybody that I'm teaching, all of my family nurse practitioners, you have to understand that you are trained to treat a person. Yes, a person comes with other things, but you're treating a person. Don't treat their insurance. It also comes with, again, going back to what Dr. Patterson said about supporting the omnibus bill, right? Because one of the things that bill is doing is saying that we are bringing this issue to life, that Black women need extra attention. And just so people understand, Black women with college education, right, masters, doctorates, have worse maternal outcomes than white women without a high school diploma, right? Black women who make, right, 70, 80, 90,000, $100,000 have worse maternal outcomes than white women who are on Medicaid, who are poor, right? So it's not a class thing, right? It's also often not a insurance thing. It really comes down to a race thing. That's why you have videos and of Serena Williams talking about and advocating for these issues because of the things that she went through just as a Black woman. So these are just some of the things that I want people to understand as well.
Now, and then the other thing, even though we are supposed to be all doing right by our moms, or in the community. I think there's something to be said about advocacy, regardless. Making sure that you're in tune to what's going on as it relates to maternal health advocacy. The March of Dimes does so much there. Blanket change is really important. Then, of course, there's the bill that Dr. Johnson just talked about. And then, as a person, even if you're not pregnant, you want to make sure that you are standing in the gap or standing side to side with, others who are trying to make, healthcare better for our moms. The other thing too is to look for resources who are providing tools for mothers during pregnancy. For instance, blood pressure cuffs. That's such an important one to have at home. Based on, being pregnant and having, your blood pressure is spiking, you have no idea that it's happening. And then bam, there's, preeclampsia. So working with organizations who are doing things in the community is another way to just sort of, continue the care. So we're talking about hospitals, we're talking about, clinics, but we're also talking about, making sure that they're doulas and, again, making sure that they have the tools that they need, moms at home. So it's food, it's clothing, it's, all the things that would allow them to relax and breathe and just be pregnant and not worried about food on the table, not worried about, all these other things that creates all the stress, which then creates a preterm birth. There's just a lot. It's such a big, wide net. It's not just one thing. There's so many different things that affect this pregnancy. In the home and outside.
Dr. Patterson, so I got a text from one of the attendees that said, going back to when you spoke about the baby blues, and she said she feels she may be experiencing pre-baby blues. Is that something that you could speak to?
Okay.
So she's expecting now second pregnancy, and this pregnancy feels very different than the first pregnancy, both emotionally and physically. But she said some of the signs you talked about with the baby blues, she's having that now. So
okay. So then we talk a lot about postpartum anxiety, postpartum depression, but we never really talk about what goes on during pregnancy. So when I see moms postpartum, I ask about their pregnancy because it sometimes has started way before, having the baby. What we call that is perinatal or antepartum or pregnancy mood disorders. It may not be a full-blown clinical, challenge that she's facing, but it is one to watch. That's what I would tell her. It's one to watch. She needs to start bringing that up to her provider, just getting them, in tune to that and making sure that they listen to you. You have to self-advocate. Sometimes it will be helpful. There's a pregnancy mood scale that is online, open to the public, that you can take. And once you do that, you take that score with you to the doctor and you say, here, this is the way I'm feeling. Can can we talk about this just a little bit more? Is this something that I need to worry about? Is this something that I need to do? It's called the Edinburgh postpartum scale. It's used in postpartum and it's used in pregnancy as well. And that scale sort of gives you a gauge to your emotions and how you're doing. And based on your score, we have to do something. So that's what I would tell her. And I'll put it in the chat. That's what I'll do, the link to it.
Thank you so much.
You're welcome.
Sorry, Crystal, there's another question in the chat.
All right, it says, how do you limit stress when you're still working and having another child at home to support?
Okay, I guess that's for me, or is it for Dr. Johnson?
I'll let you start because
okay. Can you say the question one more time? I was looking for the link.
Your mental health. It's the question pretty much, Dr. Patterson, is how do you limit stress?
Okay, how do you limit stress? That's a loaded question, because some of it you can't control. Meaning, again, if there are things that you are having to think about as it relates to just making sure that you're taken care of, those are the kinds of things that you have to sort of seek assistance for. So if there is transportation challenges getting to point A to from point A to point B, especially your prenatal care appointments. If there is, a food, a need for nutritious food, if it's childcare, that's a big one. That is a huge one. It's a stressor. And then going to work when you don't feel well. Those are some of the areas that this bill is working on. But for you, what you can control is how you respond to the stress. So again, yoga, deep breathing, a lot of spirituality is another one. So if church is or your pastors, all of that is important. Making sure that you have friends that you can talk to, treating yourself to longer shower. I mean, some of the things aren't that expensive, you know what I mean? So treating yourself to longer showers, asking for help if you have other kids at home, seeing if somebody can switch off with you so you can just get a minute. I need a minute. That's what we say a lot. I need a minute. So, those are some of the things that you can do. And then again, there are, books, there are, websites that you can go to. There's apps that you can download where it helps you to breathe in and breathe out, just so that you can, center yourself a little bit more. But the other things, of course, we are trying to help you with those types of things. Work and transportation and food and childcare and housing, all of those things are really tough.
Also, let me add to that. One of the things that can help as a Black man, protect our Black women and be there for our Black women, especially during pregnancy, right? Like one of the biggest, she's carrying your child or she's carrying your nephew, she's carrying your sibling, your cousin. Protect her. Be there for her to take away a lot of those stressors. Go to visits, attend the visits with her, because sometimes she may be too tired to listen to what the provider is telling her. You can be her ears and eyes in her decision making at times, right? Feet rubs, back rubs, whatever you have to do to help go into the store, making sure she could take time off, time to herself, watching the other kid for her, even though I hate the term watching your own child, taking care of your child so that they don't bother mom during that phase as well.
Mm-hmm.
Wow, that was really good. And I hope if he's not watching, we will send the recording link so y'all could just hit play to all the women out there, to your partners. There was another question in the chat. It says, how does the stress experienced by the mom during pregnancy impact the baby? Are there any residual effects?
There are. So stress, and this is probably a little too clinical, but I'm just going to kind of break it down just as much as I can. So there's a hormone that we have called cortisol, and that is your stress hormone. That is the one that increases when your stress levels are going up. And a long story short would be that is where the preterm birth comes in. So the stress, if that continues, if that cycle keeps going, your body is doing way too much. It's literally doing this. So you're like the swan on the water, and everyone's thinking that things are great, but underneath the water, your feet are like this. And that is what your body is doing, and it has repercussions. It has side effects. So a preterm birth would be one. Increase in blood pressure would be another. Just not doing well in the pregnancy in general. I can be honest with you, being pregnant, that was one of the things, I ended up having a preterm birth because I was so stressed as as a mom, a woman, a wife, working, all of these things. And I literally had to have a seat. I had to have a seat for 10 weeks on my back. So I will just say that, again, it is It is not something that like Dr. Johnson said, it is not a class thing. It is literally all to do with, who you are as from a ethnic, from a cultural, as a race. That is where all of this it lies. So yeah, you have to try to really lower that stress level, or else it will really do something to you. And I did everything right. OB nurse, by the way, having a preterm birth. So that alone tells you that it does not care who you are.
Thank
A
you.
follow-up I have to Dr. Johnson very quickly. Being that we are in this pandemic and a lot is going on with stress, mental health, work, and things like that, what have you seen in the labor rooms?
So some of the issues are still going on. It's been magnified by COVID, but there's also been a scrutiny placed on everything that's not COVID related. It's also been very scary for a lot of patients. Like for instance, so my best friend, we've been best friends since we were, God, since I was 13, right? I'm 36 now. She gave birth for the first time during COVID. She was afraid out of her mind because they told her you could only have one person go with you. Normally, you would have your spouse as well as your mother, right? A lot of women like having, because moms is the protectors. So you have to choose between that. I've also had another one of my best friends from college. He had his second child, so his wife was also worried because she had to go through the same thing. So there's been a lot of feeling alone. There's also been a lot of stress from moms who have tested positive for COVID. And there's been a lot of fear of the uncertainty of just not knowing of what's going to happen. I already know I'm at higher risk. What if I test COVID? What does that mean for my baby? Do that means I cannot be around my baby for another 2 weeks? So I think that's really been some of the biggest concerns that's been going on since.
So we have another question that says, would you suggest not attending a funeral of the loved one you lost? Would you suggest not attending a funeral if the loved one you lost would cause the stress you just described? Are there real superstitious or scientific facts about viewing a deceased body? So that's like a loaded 2-part question. Dr. Johnson, I saw you unmute, so you want to take a stab?
Take a stab. I unmuted because I was going to throw it to Dr. Patterson, but it's loaded because, God, like different things affect people differently. And I think that's one of the biggest things. Like we're not all the same, even within our own culture group. Like people have different upbringings. There's some cultures where if you don't go see that dead body, you never have closure. So that will affect you and put way more stress on your body. There's some other people who they didn't necessarily grow up like that, and they can get closure in a different way, right? I probably also would say make that choice for your personal decision, but then also try to be a little more innovative. We're in the area of technology. So can we possibly stream the funeral, right? To make sure people feel like they are at there, especially if they can't travel and things like that.
Dr. Patterson, I see you getting ready to type the response. So the next question would be, would you suggest getting a flu shot while pregnant?
Or vaccine?
I actually typed in the answer. I'm not sure if it went directly to the person who asked or if that was public, but I think that that's a personal decision as it relates to, seeking to get the COVID vaccination or not. And definitely something that you want to speak with your provider about. This is where you get to say, I need for you to provide the risks and the benefits, or versus the benefits of taking the COVID vaccine.
And also, Dr. Patterson, the link that you posted, you have to change it from all panelists to panelists and attendees.
Okay. To all?
Yes, all
Okay.
panelists and attendees.
Okay, got it. Thank
Yep.
you.
So a question that also came up, I'm not sure if you're able to answer it, but it's similar. It's saying, is there any research on how the COVID vaccine affects unborn babies? And they're asking again, we understand, but you have some very curious moms to be here. Do you recommend pregnant women get the vaccine?
So here's the truth of the matter, right? That some people may not tell you, some scientists may beat around the bush. The real answer is we don't know, right? And a lot of people don't understand that when you tell a patient, I don't know, I'll find an answer for you, I'll let you know when I get it, they tend to trust you more because you're being honest with them. The truth is, we don't know. The vaccine has not been around long enough for us to understand. What we do know is that everything that has been shown right now has been extremely positive surrounding the COVID-19 vaccine, right? It's just the truth of the matter. There's been a lot of side effects that you would normally get, like let's say if you get the flu shot, sometimes you get fever, malaise, you get the chills, depending on which which COVID vaccine you get. But then in regards to should you get it, would you recommend it? That again goes to a conversation between you and your provider, meaning if you are pregnant, right? We had a town hall with Johnson & Johnson about a month ago, and people from our community and people asked that question. And one of the things I told them is that you have to understand what are your risk factors. If you can go without being around people, it's not a thing for you, and you really don't want to get the vaccine, that's perfectly fine. You don't have to get it. But if you are around mom and dad, if you have certain comorbidities, if you are respiratory compromised, right? If you have autoimmune disease, or if you're around children that have things like that, that's something you may want to consider. I'm not going to force it upon you, but I think you should go out and consider getting it, because sometimes you want the protection for others, right? Like it's not always just about protecting yourself, but also sometimes how can you protect others that you may interact with? So it's a decision that you have to weigh.
Thank you so much, Dr. Johnson. And this next question goes back to something you spoke to earlier, Dr. Johnson. And it says, if a woman feels like she is not getting proper medical care while in the hospital, what are specific suggestions? So they want to be specific of ways that she can get the care that she needs during those moments, especially what you alluded to. You don't have mom and spouse in the delivery room now. So what can these moms do?
Bring me a manager, right? Let me talk to your boss. Do the same thing that some people do when they're on the phone with people, they don't like the answer that they get, right? Let me put a manager on the phone. You can say that in a hospital, bring the manager. Let me voice my concern. All hospital also should have patient services. Bring me my patient service rep. Let me explain what's going on and why I feel this way, right? Your questions and your concerns need to be answered, because too often somebody has complained, somebody has had a concern, and nothing was done, and then they eventually died from it. So you want to express this to people, speak to a manager, speak to a rep, make sure it's on file, make sure it's documented, make sure they bring you something to sign. You'd be surprised how much healthcare providers start running around when people start signing things that has their name on it, right? Like nobody wants to be sued. Also, part of that goes to us as Black healthcare providers, of how do we put these things in place to make sure our Black women and our Black families is protected from this. And this has been a common question that we have gotten. One of the things that we are trying to do is work on an app where moms can and family members can, they can have groups where they can provide these questions, and we can get a provider that can be on call to answer. This is some of the things you specifically should be asking. This is something that you should be looking for. So some of that is on us. And some of that is a part of the reason why we're promoting things like the Momnibus bill, and just being advocates and, standing in, like Dr. Patterson said, standing in the space with people who are going through those things.
And also too, just to add to Dr. Johnson, you have rights as a childbearing woman. There are childbearing rights. And, that's one of the things that Stork's Nest will be providing for the moms that go through our program, is that we're going to go over your childbearing rights, so that when you go into a space where you're having to interact with a provider, you will know how to, you will know how to act depending on the situation. So, we just feel really strongly about that, and making sure that we are saving ourselves. So, yes, there are those who are focused on the providers and doing training for the providers, but the Stork's Nest program is actually focused on making sure that our moms know how to govern themselves when they are with a provider, whether it's in the hospital, whether it's your prenatal care appointment. You will know how to talk to the providers, how to interact with them.
All right, thank you. So we have one last question. I have a family member who is multi-gravida. For those that don't know, that is someone who has had more than one pregnancy and had no issues with her first pregnancy, but had a couple miscarriages. What should she do next if blood work didn't show any issues?
So you want to start by examining some of the stress that you may be going through. Again, stress is, with everything that Dr. Patterson said before, I echo on top of. One of the things I always tell people is stress manifests itself physically through your body in one way or another. So look at your stress, look at the things that you are doing. And a lot of times that's a big part of the reason of why you're going through that. Sometimes you can also have your partner being checked out as well to see what's going on. Sometimes I think that that's something that we overlook. And it's some of the things that, because they can run the same way you have blood work, your partner could get blood work to see if there's something going on with him.
Yeah, and then just really sticking close to your providers. That is where specialized care will be, extremely important here. Fetal medicine doctors, there's perinatologists, and those are providers who, they have a background in OBGYN, obstetrics, but it goes a little bit further into, women who really need to be followed regularly as it relates to their pregnancy, and making sure that the pregnancy gets to a place where the baby will be able to, survive.
Thank you, thank you, thank you. So Dr. Patterson, you've mentioned it a few times, so we just wanted to give you this space, especially based on some of the questions. We can tell there are expectant moms, or the village is in the room. So if you want to share a little bit about the Stork's Nest program.
Sure, thank you. This is our signature program for Zeta Phi Beta Sorority Incorporated. It has been a long-standing program. It is a partnership between our organization and the March of Dimes, where we provide education and prenatal education and incentives for engaging in healthy behaviors, going to your prenatal care visits. And what we've done in response to the pandemic is that we have virtualized the program. So now you can go onto our Stork's Nest locator map, where you will register with a specific chapter that's near you. Even if you're in Wyoming and the nearest chapter is California, register with the chapter in California, because then they will be able to be your hub, where you will be provided with access to our app and our 6 virtual prenatal education sessions. And once you complete those, you will receive money. You will receive gift cards that you can use, whether it is for transportation to your doctor's visits, or the gift cards can be used to put food on the table that night. It can be to purchase baby items, maternity items for you. So you are actually paid to go through our program, and it gives you the tools that you need to, go forth with your pregnancy. But in that space, we also have webinars where you will go through as a cohort, and we sort of continue the conversation that from the lessons, the virtual lessons with the chapters in your community. And then there's a graduation where we celebrate you. It's a really exciting program. You can do it with your feet up at home, don't have to go anywhere. It's snowing outside, it's raining outside, it's too hot outside. You can do the program without, having to travel anywhere. And the graduation, our first class will be graduating in March, and the second open enrollment will start April 1st. That doesn't mean you could not connect with a chapter now. So go ahead and do that if you are interested in the program. And then we will get you signed up for the second cohort, which will start in April 1st. Excuse me, April 15th or 16th. But open enrollment it begins April 1st.
Thank you so much, Dr. Patterson.
You're
Dr.
welcome.
Chambers, there's a question in the chat in regards to, is the program free?
Yes, it is free. It is open to the public. It is open. It is open. It is open. We want as many moms as possible to come through this program. We have a lot of fun. With the moms, they get to, before the pandemic, we were on the ground, meaning in spaces where we could sit and talk with the moms, which is a little different now. It doesn't mean that we won't go back to that post-pandemic, but for now we're doing it in a virtual setting. And, the graduation is going to be different, but we're getting to celebrate you and your pregnancy and how far you have come with, just going through the process and just doing right by you and doing right by your baby from the get-go. So please, yes, share it with everyone that you know. We would love to have you.
Yes, and those in the Maryland area, I put my email in the chat. If you need help getting connected with the chapter, and I will definitely connect you with our state coordinator.
Yeah.
All right, so next week we are wrapping up our webinar series. So next week we have Step Into a Finer You, a hip hop step aerobics demonstration. This will begin at 7:30. So please join us next week. This is again another open to all event. It is not just for members of Zeta Phi Beta. It is not just for women. This instructor, she conducts class on a weekly basis. She has women, she has men, she has children, all ages. So please encourage everyone to join. If you don't have a stepper, she'll tell you just step in place. You do not need the actual step. For those of you that might have some bad knees or some other ailments and joints and things going on, she will definitely walk you through that. She can moderate for all ailments, all needs, and everything else. So we want to thank our panelists again for joining us. Please do not leave. We have a wrap up with Dr. Johnson, and we really appreciate everyone, and we appreciate our panelists because we really did get a lot of good information. And again, this conversation is so needed within our community because I know I learned a lot. It's just some things that I never heard of. No one in my family ever talked about it. No one in my family ever experienced it. So if I didn't have this session tonight, it would have just been another thing that I didn't know. And when I do get to the time of having children, it would have been a surprise to me. So thank you again for participating with us and doing this event with us tonight.
And so Crystal will place into the chat the post survey that we have at the end of each event. But we also just want to stress that what's unique about tonight is that Dr. Johnson has both a personal and professional connection to what the All of Us program is doing in the New York City area. So we thought it would be very fitting for him to close us out. But we also just want to say again, Dr. Patterson, thank you so much. You scared myself and all the women that are 35 and up. And so other than that, I do want to say this was really informative, and we are so grateful for the wealth of knowledge that you gave us, and to hear it from people who look like us is definitely the best part.
So Dr. Patterson, it's actually me to blame for scaring them because I said they may have twins.
Dr. Johnson, the floor is yours.
Absolutely. I just want to go more into about why all of us. And it's because we matter, right? Like literally our Black skin matters, and we should be represented in research. As somebody who has gone through 3 different levels of education, right? I've always wanted to do more for Black and brown people, people that look like me, people that come from where I come from. And in the science world and the healthcare world, that starts with research, right? And just to bring it back to a personal topic relating to what we're talking about today. So in in 2018, my nephew was born at 24 weeks, right? But before he was born, my sister was pregnant. She developed preeclampsia that turned into eclampsia, which is what we were talking about before. And she really wanted to die before she gave birth to my nephew, because they told her, if you don't go longer, your child won't survive. So in her eyes, she was willing to die in order for her child to survive, right? Um, and doctor came in and spoke to her, and thankfully it was a Black woman, spoke to her, and I had a conversation with my sister. She was also at a specialist hospital. She had the benefit of having a brother who has a doctorate in nursing and having a father who is a critical care nurse and has connections in the state that she lives in. And I told her, give him a chance. Our family doesn't get lucky. We don't do luck, but we fighters. So all we need is a fighting chance. And they gave him a chance, and my sister gave birth. This is with her swelling, face swelling, leg swelling, and my mother threatening everybody within audio range to go ahead and get the C-section, whether my sister wanted or not. And she gave birth to my nephew at 11 ounces, right? He wasn't even an entire pound, at 11 ounces. And he was in for the fight of his life. Blood, brain bleeds, trachs, intubated, months and months and months and months. But God willing, and because God listens, he survived. And he comes out, and he's a healthy baby right now. But in that time frame when he was going through all of that, I sat back and thought. I had another frat brother who his daughter died died from postpartum hemorrhaging after giving birth. I had another frat brother who baby was stillborn, right? And I started thinking about all the times that this had been taking place, but there was no research to go along with it. Nobody ever sat down and decided, let me look at the actual reasons why, right? Like almost as if these Black women in these Black families' lives just didn't matter. So when it came up to it, I was like, you know what? We have to do something about this. And I have some of my committee members that I've seen writing in the chat and asking questions. I told them we need to start up a committee within our Black Nursing Association chapter to talk about this issue. And they said, amazing. We've been looking for a chance. And then we had the All of Us partnership. And I said, oh, this is amazing, because we need to get Black people in there to sign up for research, but we also need Black scientists that's going to conduct these studies, because we understand that they trust us more than they trust other people, right? And we completely understand that. So a lot of times we'll get the questions of, why all of us? Why are you doing this, right? And it's because of things like this. I don't want another family to have to go through a personal experience of this before there's a provider that has learned from the research and how to prevent this. And that's all.
Wow. Well, thank you so much, Dr. Johnson. You couldn't close us out any better. Even if you're not in New York City, we know we have a lot of sorors and guests that are in the tri-state area. But if you even go on joinallofus.org, just to gain more information, because as Dr. Johnson said, the only way that we can start to have change happen is by us being willing to get the information out, but then do something with the information and be a part of it. So Once again, we want to thank you all for attending tonight. It was a very deep but needed conversation, and we look forward to future interactive chats with all of you. Have an awesome night. This concludes our program.
And please don't forget to complete the post survey in the chat.
Absolutely. Good night.
Good night, everyone. Thanks for joining.